Hello, my name is Nicole Morris. I'm a doctoral student at the University of Arizona's Global Campus studying health and wellness psychology. In this presentation, individuals will learn how the ADHD Balance Program can help those who struggle as adults with a prognosis find functionality in their lives, such as organization skills, daily tasks, schedules, and overall interpersonal relationship improvements. In this slide, we'll learn how attention deficit hyperactivity disorder, otherwise known and abbreviated as ADHD, causes those diagnosed with many daily struggles. Many adults, after K through 12 years, lack fundamental resources that are no longer available once they're into adulthood. The reason is that there's not much manpower to serve a plethora of needed mental health resources. However, due to the complexities seen in ADHD, it is essential that as an adult, ongoing support is found to help lessen feelings that may lead to frustration, anxiety, and overwhelmed mental states. That is where the ADHD Mind Balance program becomes a viable source for adults who are struggling because the symptoms that are associated with the disorder, which include emotional dysregulation, interpersonal relationship complications, feelings of overwhelmness, impulsivity, organizational chaos, low frustration tolerance, poor planning management, inability to focus, overthinking. Remember, these are not the only symptoms. There are many more that the ADHD Mind Balance Program aims to help individuals tackle. Everyone is unique, and so is attention deficit hyperactivity disorder. The program has the objective of interestingly educating new ways of thinking to people with ADHD and providing them with enough mental tools that can help them in different ADHD struggles they encounter every day. Specifically, CBD programs have been developed for adults with ADHD. However, some attempts are made by these programs to assist adults in confronting their incapacitations in everyday executive functions such as time management, organization, and short-term and long-term planning. News 2017 found that the most typical treatments for adults with ADHD ordinarily involve medications, education, psychological counseling, and skills development. In many cases, however, combining all these modalities give better results than using any separately. Although these treatments can alleviate symptoms related to ADHD, it is not a cure. As an adult living with attention deficit hyperactivity disorder, ADHD, you probably depend on medications for symptoms relief. Nonetheless, drugs cannot always be counted upon to bring about the expected outcomes. That's where this program comes into play. This is where cognitive behavioral therapy may come in handy. CBT is a type of psychotherapy that helps individuals deal with school, work, and relationship issues they face. Adults suffering from ADHD experience unique problems that ordinary talk sessions cannot address because they are mainly concerned with improving executive functioning, which includes adequate time management, organization, planning. By addressing these areas, CBT aims to help adults with ADHD overcome challenges and to enhance their overall functioning. Standard treatment approaches for adults with attention deficit disorder usually combine medicine use along therapeutic training programs on skills building and psychological counseling sessions. Medication serves as the first line of therapy, particularly when it comes to managing the symptoms of this condition effectively, but sometimes it might fail or lead to adverse reactions. This is where CBD comes in handy. Fallon 2020 surmised that cognitive behavioral therapy counsels patients on how negative thoughts and behaviors impact health by assisting them in identifying such patterns. Cognizable techniques around particularly influence coping mechanisms for ADHD symptoms management, improve mental aspects of ADHD, which the program offers licensed psychologists who specialize in cognitive behavioral therapy approaches. During these CBD sessions, people with ADHD work closely with trained therapists to develop strategies that will help them cope with their specific challenges. Such approaches entail finding ways to improve time management, set goals, break down tasks while organizing, and even developing some forms of organization, which help them immensely with their daily tasks. Additionally, the therapist will assist in highlighting negative thoughts and beliefs that prevent one's betterment. Excessive thinking about problems is a form of ADHD paralysis. A person may feel overwhelmed, frozen, and unable to make decisions or accomplish tasks in the face of ADHD paralysis. It often leads to frustration and stress, as they might need help with even a simple, straightforward activities considered routine by others. Repeatedly, their self-condemnation results from the fact that they cannot meet time limits or organize themselves properly, not listening well, and accomplishing a task at hand. Hung 2022 found that such situations are referred to as ADHD paralysis, which is marked by too much thought or analysis of a problem. It can leave individuals with a sense of being overwhelmed and mentally paralyzed when this state comes upon them. The feeling of being overwhelmed can be intensified by the realization that even a basic task becomes difficult for people with ADHD who are also incapable. The difficulty following through on deadlines could mean losing focus on other individuals' opinions and thus making them feel like a failure. Persons with ADHD experience guilt and shame because they cannot keep up with daily things in life. They blame it for failing societal expectations and meeting their own goals. This sometimes worsens mental paralysis while making it harder for them to overcome these challenges. Again, that is what this program aims to help individuals overcome. Individuals' abilities to communicate determines the quality of the relationships they have with other people. Effective communication involves delivering a message and resonating with their experiences, values, and emotions. ADHD can cause difficulties in communications, as people suffering from this type of disorder may struggle with attention and memory aspects. As such, their spouses or partners or other integral relationships might feel ignored or unappreciated, which may result in misunderstandings and emotional pain. Camp 2017 surmised that individuals with ADHD are often incapable of interpreting body language well or navigating social situations quickly, thereby making it harder for them to bond with others. They may also misinterpret comments or fail to recognize how they are being perceived by others, due to their actions. If you have ADHD, it is necessary to consider these problems and actively participate in dialogues as well as accommodate your partner's needs. One way individuals can try to improve their relationship with their significant other is through active listening, which sometimes ADHD people have a problem with because of their symptomologies. In this program, we strive to better improve interpersonal skills, which include eye contact, active listening, communication routines, through better support systems, improved relationships, and patience. This means that you will give your full attention to what the other person is saying, make eye contact to let them know that their words are important to you, and ask questions to ensure that what they are saying is absorbed into your mind. It can also be helpful when you say back what was told to you to confirm whether both parties understood each other. You can create specific communication routines between yourself and your partner. This will even help other areas of your life, such as work, conventions. Lovett et al. 2021 affirmed that this involves organizing sessions where essential subjects should be discussed, using visual aids or writing reminders to retain vital details, and opening about difficulties conveying information. Additionally, one must learn to be patient enough with oneself and their significant other. Remember that communication works two ways, hence both sides need to put towards understanding one another, thus extending the support system of each party involved, so then it will eventually become easier. By being proactive and working together over time, you can build a stronger relationship which improves communications skillfully. Difficulties managing emotions may result from ADHD, leading to outbursts of anger and frustration. Such outbursts are generally centered around the situation rather than the other person involved. Besides, at the onset of the relationship, persons with ADHD might display extreme and sometimes overwhelming love for their partners in what is known as love bombing. Soler Gutierrez et al. 2023 found that they often mimic each other, narcissism and ADHD, so that's more imperative to receive a correct diagnosis from a licensed psychologist, which this program does assessments on every individual that comes into the program, so that way you can receive a correct diagnosis and be referred with resources in what areas you may need help with. ADHD sufferers can sometimes seem self-centered during conversation because they cannot focus on anything else, and this might be confused with narcissistic tendencies. However, there are different reasons why an individual with ADHD may appear to be self-focused compared to someone with narcissistic personality disorder, and it is imperative to understand the differences of the two. In the case of ADHD, however, individuals can often appear very self-centered because they become swamped by a range of stimulus and find it challenging to stay focused on what is being said. Importantly, their lack of concentration or active listening skills is not deliberate or motivated by selfishness or other personal affronts. On the contrary, those suffering from narcissistic personality disorder may behave in such ways as being self-centered because of the symptoms like feeling superior and ignoring other emotions. Many times when they intentionally do not listen or pay attention during discussions, it means they're stonewalling, thus pushing the other person out. But regardless if somebody has ADHD or narcissism, stonewalling can be symptom-based. For instance, ADHD might stonewall their partner or somebody that's important to them, not deliberately, but because they just cannot focus. So education is key, which this program, the Mind Balance ADHD program, aims to help people with, is education. This side, we're going to talk about the inclusions of reinforcement that this program has to offer. Most effectual rewards for a person with ADHD adults are positive and immediate. For instance, a social reinforcer such as praise or a concrete reinforcer can be the single most impacting thing on someone with ADHD, since they can be granted instantly. Positive reinforcements may help adults who have ADHD by providing instant feedback or recognition as a way of motivating them towards repeating desired actions. Any form of approval can reinforce positive feelings, including compliments. People with ADHD often respond well to genuine, continuous, and instant praise. This could involve saying "good job," among others. Also, changing something desired into a reward may encourage good behavior. As an illustration, working longer before taking a lunch break could be an incentive. Moreover, physical activity or movement should be incorporated within the reward system to benefit individuals with ADHD by helping them let out excess energies and enhance concentration levels. Thus, take a short walk after finishing some tasks or engage in quick exercise that will serve as rewards for such persons because they can make them more attentive in doing other tasks. Positive reinforcements work well because it creates a pleasant and rewarding experience that makes people want to repeat the same behavior. It increases motivation and self-confidence and helps build positive habits or routines. For examples, adults with ADHD may lack motivation and self-esteem, hence the need for positive reinforcements. Leverini 2023 affirmed that individuals with ADHD usually have low self-esteem and doubt themselves frequently. Therefore, criticism can worsen these problems rather than heal them. On the other hand, punishing errors often leads to procrastination instead of motivating against repeating such mistakes. In addition, an environment is made where desirable conduct is likely to be repeated by using positive reinforcements. Additionally, it enables adults with ADHD to learn how they should respond when faced with rewards, as well as setbacks or failures. Several positive reinforcement strategies can be implemented for people who have ADHD, including task incentives, praising, giving, and celebrating achievements, among others. Hewitt, et al. 2021 surmised that positive reinforcement is a potent tool for individuals who suffer from ADHD because it gives them the support they need to overcome challenges while still achieving set goals. Another important thing about this technique is that it focuses on behavior rather than abilities, thus making people feel more motivated and confident about what they can do best. That program wants to reach into people and pull those desired behaviors out that can help them negotiate in daily life and make them feel good about themselves. Taking a look at this slide, we see the ADHD Mind Balance schedule, which is very important. The program is developed for online or in-person therapies. Having schedules helps eliminate uncertainties, and it helps the ADHD mind with predictability, goal setting, and staying on task, which further promotes the development of needed organization skills. Decision making is vital in organizing your daily activities, disposing of uncertainties concerning them, and forming good habits for time and energy utilization. It forms a part of productivity and planning, control systems, thinking, or goal-setting theories. Saffron et al. 2017 affirmed that by prioritizing essentials tasks that can waste more time if not attended to quickly, we find out what resources will be needed when they're required most for completing a program. Another thing is that scheduling helps with resources allocation by assigning people with relevant skills only to jobs that demand such skills, thus maximizing productivity while minimizing idle hours spent by patients waiting for another task. It also contributes award time management, whereby workload is evenly distributed among program development, so no one gets overwhelmed before they can finish. Moreover, coordination among different parties involved in a program is improved when there's an estimation given about how long each activity should take place, hence creating more general awareness of plan implementation methods during the execution phase, where necessary adjustments can be easily made due to better understanding arising from proper sequence according to task duration provided under scheduling concepts. Burex et al. 2018 found that having routine reduces ADHD stress because individuals already know what to expect, and efficiency improves because all resources are optimally without wasting a single bit of time. In contrast, decision making becomes easier since enough time to complete and succeed. The ADHD Mind program has been developed. Ensuring the program's method for success, critique from ADHD patients is vital for assessing the success of the wellness program. Feedback and understanding can be collected through questionnaires, discussion groups, or one-on-one interviews. Ask if they are content with the program, what they take to be advantages, and suggestions on how it could be better. A good wellness program must address different people's unique needs and wants. Chesterfield et al. 2021 found that by integrating instant real-time feedback with data analysis, psychologists will quickly identify problem areas that need improvement, thus allowing them to make necessary changes in the system. Likewise, alongside getting input from patients, it also is essential to evaluate effectiveness of the wellness initiative frequently using data analysis. Patients should track health outcomes against participation rates, among other key indicators, so developers can measure the success or failure of the scheme while still identifying solid points and weak areas. Moreover, staff comments and data appraisal need not only happen during the initial stages of implementing such an endeavor towards mental health programs. They they should continue doing this throughout the program's lifetime. This way, we ensure as professionals that our programs remain relevant to achieve the desired results consistently. Barleen et al. 2017 surmised that psychologists should therefore always keep checking what people think about their initiatives, analyzing numbers regularly if they want them to work perfectly in the future times. When situations may arise that require modifications based on new findings obtained from continuous monitoring exercises carried out under different circumstances affecting diverse populations over time. So that way, it is a program developed for everyone. Receiving feedback is critical in preventing performance problems or deviation. It can save time, effort, and resources. It can also strengthen desired behaviors. Feedback is a powerful means of reinforcing positive practices and motivating people to perform at their best continuously. Improving communication effectiveness. One aspect of good communication feedback, which allows the sender to know how well their message was received. Farrington et al. 2017 found that this helps them understand if what they meant got through, and if not, where they should work for clarity, thus preventing misinterpretation that would result in poor performance later on in the program. Identifying areas for development. Feedback gives insight into areas that need improvement by an individual or team. It points out weaknesses or the need for more skills, prompting one to concentrate on these areas, thereby heightening the overall output, catalyzing growth and advancement. Through feedback, individuals can learn from their mistakes constructively by identifying strong points and weak ones when someone receives constructive criticism about themselves. They can focus on areas of personal growth, fostering continuous improvement over time, leading to better results in future undertakings. Establishing trust and positive program atmosphere. Frequent appraisals create trust between supervisors, employers, managers, etc. Belief in their potential to succeed professionally while acknowledging their achievements in the program. Luke et al. 2018 found that such environment encourages openness since workers feel free to air their views concerning different issues affecting them within the program, fostering teamwork among patients and therapists, which aids in excellent success rates.